The fate of Martin General Hospital has been up in the air ever since it closed its doors in 2023. Today, Congressman Don Davis introduced a bill that could help the rural hospital reopen.
Amarachi Uche is live in Martin County after speaking with Davis and residents there. Amarachi?
Yeah, Congressman Don Davis says the Rural Emergency Hospital Financial Stability Act is one that will get health care back into the rural communities that desperately need it. Martin County resident Alexandra Foxwell says when her niece had a seizure recently, finding timely care was a challenge, as Martin General Hospital was no longer an option.
We relied very heavily on this emergency room before it was closed.
Since the facility's closure in 2023, residents have been advocating to get its doors back open. Now a new bill may help.
I'm glad to introduce today the Rural Emergency Hospital Financial Stability Act.
Congressman Don Davis announced Monday legislation designed to strengthen rural health care and support the reopening of Martin General Hospital. Davis says the proposed legislation would ensure rural emergency hospitals receive higher Medicaid reimbursement rates, aligning them with other outpatient hospitals. Working with Republican Jack Bergman from Michigan to pass this act, Davis says bipartisan cooperation will help the rural communities.
Democrats need care, Republicans need care, independents need care. We all need care.
This May, ECU Health announced its proposal to take ownership of the struggling hospital and to open the state's first rural emergency hospital. It's a move residents say is needed.
We very much need to have that rural emergency room.
With the Senate debating President Donald Trump's big, beautiful bill, Davis urged residents to speak up as it could have an impact on the rural community.
That just because we're in rural America, that our voices shouldn't be left out of this process. We should be a part of this process.
A community he says deserves a fighting chance.
You may be a ways from the city, but that doesn't mean that we deserve to be forgotten.
Now, Davis says Eastern Carolina has lost 4 hospitals in over a decade, so it's important to check the stability, the long-term stability of the Martin General Hospital, so if it ever opens its doors, it stays that way. Reporting live in Martin County, Amarachi Uche, WITN News.
All right, thanks, Amarachi. And according to Davis, reopening the hospital would help the county economically and bring jobs to the area.